Joining us now, Dr. Kavita Patel, a physician who served as White House Health Policy Director during the Obama administration and Brookings Institution Fellow, and also now want to also bring in the fact that Israel is going to start using the Pfizer booster shot for people who are compromised, in particular, cancer patients on immunotherapy, liver transplant patients. So first, let's talk about what Dr. Fauci had to say about the idea of a booster at all just this morning.
What Pfizer did, understandably, they looked at what their data and they say, hey, you know, based on what we see, we think people should get vaccinated with a boost. Well, that's fine, except they're not the official recommending organization. So although they do good work, they have study and data that we will go over with them to determine if there's anything there that we need to use.
So, Kavita Patel, whom should we trust? The Pfizer who produced the vaccine, or the scientists, the government scientists who, are in charge of authorizing it and are saying that they're looking at the data?
Andrea, the perfect question, and it's unfortunate that we're even having to ask that question. We should absolutely trust the scientists. By the way, I would say it's not even just the government scientists, it's the administration officials today, as you point out, but it's also the advisory committee that has been incredibly important with the CDC, outside members, for the most part, who are scientists, public health officials, who are part of that deliberating body, all transparent, all out in the public, of who should get which shots and when. That's where this conversation needs to happen. I'll just say that do not worry. This Israeli news is not shocking. We do know that for about 5% of Americans, Andrea, as you mentioned, cancer patients, people with solid organ transplants, and potentially some frail elderly, that a third dose might actually give the immunity that many people, myself included, have benefited from with just the 2 doses. But that doesn't mean it's for everyone.
And we should also point out that Israel was part of that Pfizer test group. That's one of the ways that they got their country vaccinated so quickly. Their country, I should say, but not the Palestinians. They did not permit any of that Pfizer vaccine, at least initially, and maybe not still now, to get to the West Bank, to Gaza.
Yeah, the inequity, by the way, that will mirror, and what I worry about with this confusing messaging from Pfizer, unfortunately, it sounds like it's Pfizer, quote, versus, administration officials. That should not be what we take away, but it is, because we still have, as you pointed out, a little bit under half the country that has not been vaccinated. Imagine that in some places, Andrea, this just gives fuel to that notion that we do not need to be vaccinated because the government and the manufacturers can't even agree on what we need to do. And that is unfortunate. And I hope that we can clear that up now, that this is a conversation that should be led by scientists and public health officials.
Now, is the pushback from the administration also because they're concerned that they need to be focused on the people who are not vaccinated yet? And these efforts, which become more critical as the Delta variant spreads, and potentially these people, many of them in red states, many of them young men, many of them perhaps responding to the political impulse. We saw it again at the Conservative Political Action Group this weekend. Is that potentially a problem? Because those people become petri dishes for other variants as well.
Right. Yeah, it's definitely, putting my kind of former White House hat on, it's definitely in all of the COVID task force members' minds. But I will say it's really the data that's leading this conversation. As Dr. Fauci and others have pointed out, we simply do not have evidence that we need that third shot. And boosters are confusing in and of themselves as a term. We're talking about a third shot of the same shot that dose 1 and dose 2 are. They're also working, all companies are working on some quote unquote booster or kind of second set of vaccines that might be tweaked to deal with those variants, Andrea. So yeah, you're absolutely right. Messaging, and we saw some of this, Andrea, during the Trump administration, conflicting messages between state, local, and federal officials. Now we're getting some of these conflicting messages from the manufacturers and the government.
Dr. Kavita Patel, as always, we really value your expertise. Thank you.